RVA Today is made possible by today's sponsor.
Welcome back to RVA Today. I'm Naomi Brackett, and today's sponsor is Virginia Cardiovascular Specialists. And I'm so pleased to be with an actual heart specialist,
Thanks
Dr. Michael Rehorn. It's a great time of year to be talking about these things. It is American Heart Awareness Month, so you may have been seeing some other things around, people wearing red. But I know that you guys are a practice who just specialize in heart care. Can you give me just a few words about what your practice does and how you serve the community?
So, Virginia Cardiovascular Specialists, we're an all-encompassing cardiac group or cardiology group. We see patients with a variety of cardiovascular illnesses ranging all the way from preventative care, managing high blood pressure, all the way up to patients who need interventions like stents placed or even pacemakers, defibrillators, or even procedures called ablations, which is more so what I do.
Okay, so a wide range of
That's
heart
right.
care and lots of doctors at your practice. I know that this is a topic that's very close to me, probably to a lot of you people at home. And today we want to talk about one very particular condition, which is atrial fibrillation. Will you tell us a little bit about what that is and why it's important?
Sure. So AFib is actually a very common heart rhythm abnormality. So it's pretty much characterized by a very irregular heart rhythm. So patients will often describe it as feeling their heart beating out of their chest, feeling palpitations, and sometimes associated with dizziness, lightheadedness, and at times even passing out. And it's becoming more and more common, probably just as the population is aging and our ability to recognize it is better. It's associated with a variety of other conditions, the main one being stroke, and that's why we think it's really important to raise awareness for atrial fibrillation so that patients who may have some of these symptoms can be evaluated and potentially started on treatments.
Yeah, so not only unpleasant symptoms to feel, but also maybe the indicator of something quite serious. How do people get evaluated for something like AFib?
It's a good question. So anytime somebody has any of these symptoms, and again, sometimes it can be asymptomatic, being evaluated by either primary care provider or even reaching out to a cardiologist. And we are happy to see any new patients in our group who may have some of these symptoms. Sometimes it's as simple as just a check-in in the office and getting an EKG, where we can assess the heart rhythm, or doing a long-term monitor where somebody will wear it for some time. And actually, in some cases, people are using devices like the Apple Watch, which can pick this up as well. And so we actually see a number of patients who may have been diagnosed by their Apple Watch that they received as a gift or something like that, and actually in a variety of cases it is correct.
Wow,
and
what,
so it picks
what
it up.
incredible technology I think we have now, that even at home you can start to tell if something is going wrong, and really be able to monitor that. How long would you say it usually takes someone to get diagnosed with AFib?
It's actually fairly quick. So if we find it when somebody comes in the office, which we will detect on an EKG, we will start therapy at that time, and that can range from starting new medications that can control the heart rate, or even starting medications like a blood thinner, which in many cases is really important for preventing the risk of stroke associated with AFib. And then from there, depending on how somebody responds to treatment, we may end up recommending additional even procedures or medications down the road. Okay,
so this is something that can mostly be controlled with medication. How important would you say that it's early? How important would you say it is to catch it early?
So from multiple perspectives, so the main one being that of stroke, catching it early, we can prevent a stroke that may happen years down the road by getting somebody started on the right treatment. We're also learning that by treating the AFib earlier in the disease course, so when somebody is diagnosed within the first year or two, if we start managing them a little more aggressively, trying to keep them out of this arrhythmia, we can prevent some of the downstream consequences that may take effect years later.
Okay, so something that's so important to get checked out if you're starting to have any kind of symptoms.
That's right.
Would you say that there's a particular age group or gender that's more likely to have these symptoms?
So we know, if you look at the data within the United States, population 60 plus tends to have a higher risk of atrial fibrillation. But we do see it in young people, and in particular, sometimes we even see it in young, healthy athletes that may develop this.
Okay, so super important to get checked out no matter who you are, what age, if you're having kind of an irregular heart rate.
Exactly.
And you can do that by visiting Virginia Cardiovascular Specialists online at vacardio.com.
That's correct.
All right, well, thank you so much, Doctor.
Thanks so much for having me.
Great to meet you.
Great to meet you as well.
And thank you so much for watching RVA Today. We'll see you next time.